Welcome to CityWise. I'm your host, Tiana Stevens. CityWise is produced by the City of Rochester to shine a spotlight on city living at its best. Well, more than 100 years ago, what's now known as Jordan Health began as one small center created to provide accessible and affordable health services to Rochester residents. Today, Jordan Health serves nearly 30,000 patients in the city and beyond. We're joined by Dr. Janice Harbin, President and CEO of Jordan Health, to tell us more. Thank you for coming on.
Thank you for inviting me.
So if we could start with a brief history of Jordan Health, how did it get started 100 years ago?
Well, 100 years ago, we actually started Baton Street Settlement. It was actually two Jewish women in that community that actually identified the need to support young mothers and their babies. It slowly grew into what was now known as Baton Street Settlement. Jordan Health actually in the late 40s, 50s became a health center in the basement of Hanover houses. And in the 1972, we moved to the facility now known as the Anthony L. Jordan Health Center. And it started as the People Community Health Center, and there was a movement because of the legacy of Dr. Anthony L. Jordan and his belief that all residents, all people deserve quality health care, that regardless of their ability to pay, that the center should be named after Dr. Anthony L. Jordan, and it was thus named the Anthony L. Jordan Health Center.
And how many centers are there today?
Currently we have 10 locations in 2 counties, plus an urgent care center. We grew very rapidly from the fall of 2011 from one center, the Anthony L. Jordan Center on Holland Street, and one WIC Center on Upper Falls, to 10 locations by the spring of 2013, including the former West Side Health Centers of Woodward Center and Brown Square on Lake Avenue.
Who do you serve? Who can receive services at Jordan Health?
We serve everyone. I think sometimes people feel that, oh, you have to be uninsured, you have to be homeless. We service the community. We have patients that have no insurance when we have a sliding fee schedule. By our mission and by our designation as a HRSA site, a Federal Qualified Health Center, we serve everyone regardless of their ability to pay. So you can walk in the doors and receive service, medical and dental services, behavioral health services, podiatry, optometry. We have labs. We also, in 2013, opened up a urban mammography, so you could come and have your annual mammograms, which we are doing a campaign later in the fall regarding mammography to get women of color to make sure they come out and have those mammograms.
Why is it so important to have so many locations throughout the city and beyond?
Yeah. Historically, and I have been in community health for over 30 years, historically, access to care has really been a problem. Transportation, I'm originally from the city of Detroit, the Motor City, where 30% of the residents did not have cars. So trying to get to healthcare is an issue. We decided to take healthcare into the community where the people are. So 3 of our centers are comprehensive health centers. We have 3 centers located in housing authorities, so Rochester Housing Authority. To service patients, we now Threshold, which was a safety net for youth and adolescents, that is now Jordan at Community Place, school-based centers. It's important to take it to where the people are so that we remove those barriers.
Sure. And you guys have been busy planning a new event, the Front Porch Festival. Can you tell us what that is?
Very excited about the Front Porch Festival. Again, I've been here for 4 years. July made 4 years. Everywhere I went, someone had a history to Jordan. Whether I was at the Rotary Club, whether I was at the bank, everyone says, I have a connection to Jordan. And I kept thinking about a family reunion. We need to have a family reunion. We have an annual health fair, but I didn't feel that we were reaching all the people, all of the community. So this year we'll have the Front Porch Festival. It will be in Baden Park, July 30th from 10 to 2 o'clock. And very excited. We're hoping to get 2,000 people out. I have a meeting this afternoon, a community report and forum with our pastors. It's just exciting to get community to come back home, just come back to home. And we have been the safety net in this community, as you said, for over 100 years. It's important to just reconnect the patients and reconnect the community.
What is the significance of the name, the Front Porch Festival?
The Front Porch, Dr. Anthony Jordan, and I know this because that's one of the things I learned about Rochester from my husband, was that he had a house, and in the house, the front porch was like the waiting room. So all the patients would gather on the front porch, and then he would come out and say next, or come on in, you're next. And a lot of folks, especially the baby boomers, they remember that history about that front porch. We're fortunate to have Dr. Jordan's daughter, Millie Jordan Reynolds, is on our foundation, and she can relate about that porch. And so it has a lot of good memories and fun memories about how you could go with no money. And we have a video from his wife where she talked about receiving cakes and chicken instead of getting money for payment.
Right.
Because folks know that they could receive care. You just show up and you could receive care. We wanted to bring that memory back to the community.
So what type of things will be happening at the Front Porch Festival?
Well, it is a health fair. So we will do, traditionally we'll do our health screenings. We'll have our dental center open because the park is right across the parking lot from our health center. So we will set up and do preschool exams and cleanings and HIV testing, Hep C testing, a lot of information about health care. We'll make sure that our mammography is open that day so that folks that want to kind of walk in and have their mammogram, because they're right there, and we'll encourage them to have it. But it's going to be fun for the family. We have the Zoomobile. We'll have face painting. We have bounce houses. We have the fire department and the police, that we want to connect, that this is a community, that we're all members of that community. And so it's important that it's a fun day, but it's also a learning day so that folks can learn more about their health care.
So along with the people that have a connection to Dr. Jordan, who else do you want to come to the Front Porch Festival?
Well, again, I think that it's a great opportunity for folks who do not know about Jordan Health, that have never heard of it, or I kind of know something about it's a health center, but what kind of health center? I want to open it up so that it gives a chance for all communities, whether it's the city of Rochester, outside the city of Rochester, to know that you have a jewel in this community. That I'm, like I said, I've been doing community health for over 30 years. I'm a firm believer we're all in this together. What opportunities do we have that we can come together, work together, and move the community forward together? So I think it's a good opportunity for a come and see and learn opportunity.
Sure. Along with the challenge of transportation, what do you think the other barriers are for people needing to get health care?
Education. I think increasingly with our refugee population, at our Brown Square location, we have close to 19 different languages spoken at that location. Being culturally sensitive so that folks understand, do I understand you and your needs and what's traditionally you know about health care. I remember years ago asking a mother, well, the child about their yearly physical. Well, I was from the city where a child had a yearly physical. And the mother said, well, there's nothing wrong with my child. Why would I take him to the doctor if nothing's wrong? So I think the educational piece, I think, again, going into the community, I think that's one of the great things about what's going on with Jordan. We understand that we cannot just stay inside those centers and hope people come to us, that we're going into the communities, going into their associations and their programs to say, how can we be more effective to work with you and educate you? So I think education is a big piece.
Sure, and I know the city is a proud sponsor of the Front Porch Festival.
The city is.
Other partners, community collaborators?
It is, well, Your Care is our lead sponsor for this event. The city of Rochester, and I have to say the mayor, Lovely Warren, has been really just tremendous in understanding the need for not only health care, mental health and behavioral health is increasingly a concern in all communities, not just in the Rochester community, but a willingness to say we're in this together. How can we be collaborative? How can we support each other for the good of the community?
And I know the Rochester Monroe Anti-Poverty Initiative report just came out, kind of underscoring the need for these collaborative services. And you mentioned mental health. How does Anthony Jordan or Jordan Health play a role?
Well, Jordan Health, I was co-chair of the health and nutrition for the Rochester Monroe Anti-Poverty Initiative. After community forums, after all the work groups met, one of the recommendations was for a centralized location for safety net activities.
Okay.
Jordan has been advocating for a couple years now about a community health campus that we felt we know what we do best. What we do best is primary care. But we also know, and I'm a dentist, I don't know if you know, but I'm a practicing dentist, so I still see patients twice a week. And I know on Monday mornings when I have an emergency with a mother with 2 kids and a stroller at 8 o'clock in the morning, if she had child care, she would not be coming in with a toothache carrying those 2 kids. So again, with the campus, we're looking at child care, we're looking at educational components, we're looking at substance abuse components. Those are things that we will not do ourselves, but we will be facilitators, bring the folks onto the campus. How does that support the family and that patient and the entire family? So we're very excited about the possibilities of that, and we continue to promote that.
Wonderful. Well, thank you so much for your time today. If you'd like more information about Jordan Health Services and community events like the Front Porch Festival, visit jordanhealth.org or call 585-423-5800.